So according to data from the Centers for Disease Control and Prevention, of people 65 and older last year, 64% had gone to the dentist. But does Medicare even pay for this? Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm telling you guys about the most common things that Medicare doesn't cover and why it matters. And I'm just going to go over a real quick list of some of the most common things my clients don't realize so that you're not caught off guard. But hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this content helpful. I really appreciate you doing that. Okay, so the first thing that original Medicare does not cover is dental, vision, and hearing. So the only type of coverage you're going to have for those three things are if it's medical. So under dental, if you get in like a car accident and you have to have reconstructive jaw surgery with dental work, well, that's medical. So certain parts of that would be covered, but cleanings, exams, x-rays, dentures, implants, routine and comprehensive dental is not touched by Medicare. When it comes to vision, things like cataract surgery and glaucoma, medical benefits are covered. But your routine eye exams, glasses, lens, and contacts are not covered by original Medicare. And then furthermore, hearing aids. Hearing aids are not touched in any way by Medicare as of 2025. Now, some of these benefits can be found in Part C Medicare Advantage plans, but each package is different, and that's the private insurer paying for those services, not Medicare. Okay, the second big thing that my clients are really caught off guard when they hear is that Medicare does not pay for long-term care. So if you ever have to end up in a nursing home long-term because you need round-the-clock assistance, you don't have a caretaker, or your health is just at that level, Medicare does not pay for that. So what Medicare does pay for is skilled rehabilitation at nursing homes. So if you had a stroke or you had a knee surgery and you had to go temporarily to rehab, that type of thing's covered under Medicare. But what most of my clients are caught off guard is if your parent or you or somebody you know has to go to a nursing home to stay, Medicare does not touch that at all. It will not pay for days at a nursing home if it is for you to permanently reside there. Okay, the number 3 thing that catches my clients off guard is that foreign travel is not covered by Medicare. So under original Medicare, when you are outside of the United States, Medicare does not cover you. Now, under Medicare supplements, there are certain supplements that will pay a percentage out of the country. And under Medicare Advantage plans, the plan has to explicitly state that it will cover you worldwide. But under original Medicare, there is no coverage when you leave the United States. Okay, and the last thing that catches my clients off guard is in-home nurses or home modification. So a lot of people wonder why their plan won't pay for nurses that come in home and help them. So Medicare will pay for that on a short-term basis, but that has to follow a hospital admission or a nursing home admission. And the goal there is just to get you situated at home. That would not be on a long-term basis. So when you need daily assistance with your knee, when you need assistance with daily activities of living, Medicare is not going to pay for nurses to come in and to take care of that. The way you're able to get that covered on Medicare is if you also qualify for Medicaid. But original Medicare will not pay for private nurses to come and help you do things like bathe, clean, eat, go to the bathroom, or anything of that nature unless it's on a short-term basis following a hospital admission or a stay at a nursing home. Okay, guys, so don't get caught off guard if you're on Medicare on those 4 things. And again, that was dental, vision, and hearing, not going to be touched by original Medicare. If you have to live in a nursing home, so nursing home stays, permanent living, not going to be covered under Medicare. Thirdly, if you leave the country, if you go on a cruise, you go to visit somebody, buy some kind of supplemental insurance because original Medicare is not going to pay out of the country. And then lastly, if you need round-the-clock nurses, you need in-home care, Medicare will only pay for that on a short-term basis following a hospital or a nursing home admission. So guys, I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group.